Good afternoon, everybody. Allison and I are going to try a new format to get some of these quarterly updates out to all of you. So we're going to record this kind of slideshow presentation, and then she's going to put it up on SharePoint. So we're hoping this works. So we're just going to run through all the information that I talked about in the conference rooms the last couple of weeks and try to get it out to you this way. So we have these on a quarterly basis. I do them in person. I do them in lots of departments, and then also in lots of other areas, kind of outside Salida for four purposes. Allison, if you can go to the next slide, for three purposes. We want to share with you what's going on here, outlining current and future goals, really get your feedback about what we can do to make this a better place for all of us. I know since this is not in person, it'll be a little bit more difficult to do, but you can always reach out to me. And then we also want to be available to answer your questions. And even though we're not doing this in person, always happy to answer any questions you have. So first, some recent news. We recently engaged a group called Stroudwater Associates. They're a rural healthcare consulting firm, have literally worked with hundreds of rural hospitals to help us create a physician development plan. You can sort of think of it like a physician succession plan, really thinking about needs by specialty and location over the next few years, primarily focused on primary care, because while we've done a great job recruiting specialists, we've done that almost to the detriment of primary care. So we're really focusing on primary care the next couple of years. So we're excited about that work. Dr. Thaisa Weedle was recently selected as our Vice President of Medical Affairs. She's doing a great job. Planning for her to lead quality and patient safety initiatives, and then also provide physician leadership on the Epic transition. But she'll also kind of sit at all of our senior leadership meetings and contribute in all sorts of ways. So we're really excited about Dr. Weedle. And then also selected Nika Starr as our new Vice President of Patient Care Services, taking over for April. We're really excited to have Nika on the team, and she's really fitting in quickly. So welcome both of them when you see them. Some other recent news, the employee engagement survey begins on June 22nd. So this is something we do every other year. I've not been involved in one yet, but just ask that you participate in that. You're going to get an email with a link to a survey about what you think is going well here, where we have opportunities to improve. So please be frank. Those are anonymous, so you can say whatever you feel like you need to say. We are going to do some door prizes. Although we can't see individual results, we will get a list of who participated. So we're going to do some drawings, not exactly sure what, but we're going to try to make it worth your while to participate in that. We have a board retreat scheduled for late May. We're going to take the board away for a couple days. We've got a consultant working with us. They're just committed to being a good governors for this organization, and so we're excited about that couple days with our board. Cancer Walk is May 2nd. I don't know how soon we're getting this up, but that's actually tomorrow. Check-in is at 8 o'clock. Registration is $35. Leslie and her foundation team are really excited about this year. I think we're on a record pace. And of course, all those proceeds benefit the oncology patients. Hospital Week is in May, a week and a half from now, and we've got lots of neat things planned for Hospital Week, so I hope you'll participate. And then rehab services are going to start in Fairplay sometime this month, maybe closer to June 1st, but we're excited about expanding care up in Fairplay. A little construction projects update. I know a lot of you have seen this before, but this next slide will be what the first floor is going to look like. A little overview of the east expansion, kind of the front expansion. There's going to be wound care and physician space on the first floor, oncology and infusion on the second floor. We had originally thought about them being on the third, but just for kind of adjacency to pharmacy and the floor and other things, we decided to move that to the second floor. And then cardiac rehab and the wellness gym will move to the new third floor, primarily to help decompress existing rehab services space in the outpatient pavilion. So again, you've probably seen this picture before, our existing kind of picture of what our campus looks like minus construction right now in the upper left. And then what we're building, that addition, you can see that egress stairwell with the stone facade, and we're kind of building all that to the left, and then the new canopy and above the new canopy. The next slide is the first floor plan. I wish I had something that I could point with, but I think you can probably see where the current outside front wall of the hospital is. Oh, Allison's pointing. So that really light blue space is an expansion of general surgery, for general surgery and wound care. We had talked originally about having a hyperbaric oxygen chamber or two in that space that Allison can point to. We've decided to postpone that a little bit just because of changes and kind of Medicare coverage for that service. And then green down over where the kind of landscaping used to be, there's going to be some future physician suite. It's not very large. It can probably accommodate a couple physicians and maybe a APP. So maybe that's cardiology, maybe that's internal medicine or geriatrics. So not exactly sure, but more to come there. The next page is the second floor plan, and we've really made good use of this space. So in the upper left, there's going to be a little corridor that walks through kind of where the existing chapel is. That's where that corridor is going to connect, and it's going to be infusion waiting. And you can see on the right side of that drawing is infusion space. And then the left side of the drawing is oncology clinic. So we're going to have both those services together. Because of the footprint of this building, we couldn't really figure out how to have one kind of single reception area and then be able to divert patients both ways. So there's actually going to be a check-in space on the infusion side and on the oncology side. And then the third floor, again, is just relocate the wellness gym and on the left and relocate cardiac rehab on the right. There's going to be really some great views up from that third floor, and so we're excited about that new space. And then after this is done, we will do some minor rework of the existing second floor in the outpatient pavilion, again, to try to decompress some of that space and provide a little bit more privacy than rehab services currently has. Timelines on all of this. For the east expansion, they're expecting the core shell to be the building to be done at the end of 2026. We'll probably take a quarter or 4 months to finish out the inside with tenant finishes. And so we hope to occupy that in early April, maybe May of 2027. So excited about the east addition. An overview of the back addition. None of this work has started yet, but we have a plan for a 3-wall expansion of the back of the building to give Gerald and his team some more space in supply chain, an expansion of radiology, and then surgery. So we're going to look at that drawing next. We don't have an existing rendering. I think most of us park in the back and walk through the back, so we know what that looks like. But this is what the new back will look like. You can see they brought a lot of those design cues from the front of the building to the back with the metal panels and the stone facade. The next slide kind of shows that it's really just a 3-wall expansion out the back of the building. That red line is the current back wall of the hospital. So those of us that come in the back go through this doorway where Allison has her cursor. And so just expanding that, you don't see much or actually any of the image or of the supply chain space we're adding in the upper left corner, more warehouse space, kind of doubling the space size of materials management. And then everything where Allison's cursor is really pushing the support spaces to the OR to the back of to the perimeter, adding a couple large ORs. And then on imaging, most of that space will be shelled or storage space, but we do have a plan to bring a PET scanner in-house, so that can be here full-time as opposed to 3 Fridays a month like we do now. Now, this will be a little bit more disruptive to most of us because you can imagine a lot of the parking, not a lot of the parking, some of the front rows of parking behind the building are going away. And then also going away is kind of where we enter the building currently. So there will be options to either come in through the cafeteria or supply chain, or the lab and ER folks may still come in through the ambulance entrance. I'm not really sure, but at least while this is being built, there will be some difficulties in entering the building. And so we just ask for your patience with all of that while we get this thing built. The next page, just some discussion about what that back addition and kind of the OR plans. We had initially planned to convert the pain suite to an OR and add an OR. That was going to be very disruptive. We didn't really have a plan for what we would do with Dr. Wolkowitz during that, 18 or 24-month time period. So we've revised that, and so we're going to add 2 large ORs and really leave the existing pain suite and all the OR space untouched during construction. So the final product is going to be 5 ORs, a pain suite, and a GI suite back there. Really gives us a lot more capacity than we need in the short term. But as we're going to talk about in a little bit, we continue to have lots of luck recruiting physicians and surgeons. So we're gonna need that space over time, even though we don't immediately. There is a little bit of movement with our pet situation because the current mobile pet trailer that comes 3 days a month sits right in the middle of where that construction is going to take place. We needed to find somewhere else to put the PET scanner. We had initially thought about just having the trailer here permanently parked outside the ER. We've since decided to place a little modular imaging suite right outside the ER entrance, sort of on the other side of the stairway, kind of adjacent to the ambulance entrance. So there's going to be this little building. We're going to purchase the MRI and put it inside that building so we can use it 5 days a week throughout construction. And then when construction finishes, we'll move that PET scanner inside the building. I don't remember, Allison, what I've got next. So there's a little drawing. That blue block is where that modular unit will sit, and you can see that it's sort of right outside the ambulance entrance, and then those stairs that come down and sort of create a canopy for the ambulance to drive around. So we're excited about that. It's actually going to save us about $1 million to do that as opposed to what we had originally planned. So what about Buena Vista? Back in 2019, sort of pre-COVID, we had started to do some preliminary planning of what an expansion at BV might look like. And so we'll look at that in just a second. We may look at options for a smaller expansion. We have initially kind of conceptually designed about 40,000 square feet. Maybe we don't need that. Maybe there's something smaller. We are kind of starting to need some additional primary care space there. And we'd also like to be able to accommodate more specialty care. We've recruited great general surgeons and urology, and, neither of those specialties currently go to BV. And so we might like to try to do that. And so we're going to spend a lot of this year thinking through what makes sense to do at BV. But just to let y'all know, we hadn't forgotten about that. The next slide is sort of a drawing of what that looks like. If you're familiar with that campus, we built this section on the left of this drawing and left the existing clinic and attached it to the existing clinic. And so that the bottom picture here is the conceptual design of the entire project. Maybe we don't do something that large. Maybe we do something a little smaller just to create some more physician space in the short term. So more to come about BV. EHR update. I hope you all are excited about this transition to Epic. We're really excited. It's going to be a lot of work, but it's going to be so good for our organization and our patients and community. So we've transitioned that EHR selection committee to an EHR steering committee. And Jess has really done a good job leading all this for us for the last 14 or 15 months at this point. We've contracted with somebody named Jenny Field. She previously worked at Meditech and also helped lead the Epic install at Gunnison Valley Health last year. So she's going to be a real resource for us. Still planning a go live in May of 2027. Implementation begins May 1st. We actually had our kind of first kickoff meeting yesterday on April 30th, but we're really excited about that. So more to come. Physician recruiting, always have lots of good news with physician recruiting. Dr. Michael Atwell will arrive on Monday, May 4th. He's a friend and colleague of Dr. Weedle, so we're really excited to have Dr. Atwell here. We're going to be able to expand kind of outreach to our valley and even the San Luis Valley with his arrival, so we're excited about Dr. Atwell. You'll like him. Dr. Catherine Gassman is a family medicine OB that started in February. And then we've also recruited a Dr. Hannah Dunn that will arrive late summer. Still working on geriatrics and trying to recruit a partner for Dr. Altnew. So more to come about that. ENT, Dr. Christopher Maughan has accepted his employment offer. He will be in here in September. But we retained Dr. William Dittar to help us through the summer. He's coming to us from the Air Force Academy. He seems to be being really well received, and I think would sort of like to be here longer term after he finishes his commitment to the Air Force. So we're really excited about ENT. A new hospitalist, Dr. Adam Shepardigian, will come on full time beginning in October. I think some of you know him because he works PRN, but he'll be here full time beginning in October. On oncology, you've probably heard these names before, Dr. Dustin and Dr. Victoria McCurry. He's an oncologist. She's a family medicine physician. He grew up in Canyon City. They're really familiar with our community. He's currently working at MD Anderson in Houston, and she also works in Houston. So we've been working on them for several months. I really think they're about to commit to us, but not official yet. But things are looking good. So we're really excited about his arrival, and kind of that being the first step toward us building a really much more robust oncology service. So excited about them. We've extended an offer to Dr. Lucas Oman. This is Jan Oman's son, from nurse practitioner in BV. So some of you may know him. He's finishing a residency in Grand Junction next summer, so he'll start sometime late summer next year. So we're really excited about Dr. Lucas coming home. We've talked to a husband and wife couple from Colorado Springs. She was actually here today. Both primary care physicians, love Salida, come here all the time. And so we're speaking with them about opportunities at Salida Health Center and Westcliff. So more to come about them, hoping to get good news from them too. And then Dr. Annalise Mann, this is a physician. She grew up in Basalt, went to Aspen High School, is finishing a residency in Montana, but late summer she's going to come to us and start in Fairplay 3 days a week, and Buena Vista 1 day a week. So we're excited about all these physicians and potential physicians. Another name some of you will know, Dr. Tyler Stinson. He's coming to us late summer, finishing an emergency department, an ED residency. He has worked in our emergency department actually before as an ED tech prior to med school and residency work. So we're excited about Dr. Stinson coming back. So that's all the information I had to share, but really feel free to email me, text me, whatever, anytime if you have any questions about anything I talked about, anything I didn't talk about.